Good day everyone. Today we are going to tackle about parasitic protozoans, especially the protozoan Toxoplasma gondii. This comprehensive report is prepared by Ms. Milaine Barbibi, Ms. Jovelyn B. Ferrer, Mr. Tonio Sabas, Ms. Emma Rose DeFranco, and Ms. Login Lagura. Now let's proceed to the overview of Toxoplasma gondii.
This is the overview of Toxoplasma gondii. Toxoplasma gondii or T. gondii is significant protozoan parasite of medical veterinary significance. It is the etiologic agent of toxoplasmosis, a neglected disease in which incidence and symptoms differ between patient and regions. In immunocompetent patients, toxoplasmosis manifests as acute and chronic forms. Acute toxoplasmosis presents as mild or asymptomatic disease that involve under the host immune response into a present chronic disease in healthy individual. Let's proceed to characteristic of Toxoplasma gondii. Toxoplasma gondii exists in three forms. All parasite stages are infectious. First, we have thylazoites, brazozoites, sporozoites. Toxoplasma gondii occurs in three infectious stages: thylazoites and brazozoites in tissue sites, develop inside the host, while sporozoites develop within cut-shade oocytes. These stages are linked in a complex life cycle.
Next will be the classification of Toxoplasma gondii. Clade SAR. Its infrakingdom is Alveolata. Its phylum is Apicomplexa. Its class is Conidacida. Its order is Eucosideuridae. Its family is Sarcosistidae. Its subfamily is Toxoplasmatinae. Its genus is Toxoplasma, and its species is Toxoplasma gondii. Let's proceed to the host or host range of Toxoplasma gondii. Toxoplasma gondii is a protozoan parasite with a complex life cycle and a cosmopolitan host range. It have a sexual part of its life cycle. It can be perpetually sustained in a variety of intermediate hosts through a combination of carnivory and vertical transmission. However, Toxoplasma gondii produces gametes only in felids. After the predation of infected intermediate host, the parasite changes the behavior of its intermediate host by reducing their innate fear to cat odors and thereby possibly increasing the probability that the definitive host will devour the infected host.
Now, let's proceed to pathogenesis or modes of infection and transmission. T. gondii infects not only macrophages but also many other cell and types of incorporation processes actively controlled by protozoan. Most cases of toxoplasmosis in humans are probably acquired by the ingestion of either tissue cyst in infected meat or oocyst in food contaminated with cat feces. Toxoplasma gondii does not produce a toxin necrosis is caused by intracellular multiplication of thylakocytes. Now, let's talk about symptoms, prevention, control, and treatment of the Toxoplasma gondii. Diagnosis of toxoplasmosis can be aided by serologic or histocytologic examination. Clinical signs of toxoplasmosis are nonspecific and cannot be depended on for a definite diagnosis. Toxoplasmosis clinically mimics several other infectious diseases. For example, shedding of oocyst fecal samples or zoonotic risk, and serology on ill animals.
To prevent T. gondii infection, several precautions should be taken. Meat should be cooked to 66 degrees Celsius throughout before eating. Hands should be washed with soap and water after handling meat. Raw meat should never be paid to cut. Only dry or canned foods or cooked meat should be paid. Cats should be kept indoors and litter boxes changed daily. Cat feces should be flushed down the toilet or burned. Litter pans should be cleaned by immersing them in a boiling water. Gloves should be used while working in the garden. Children's sandbox should be covered when not in use.
Treatment for cat shedding, not tighter shedding, is the infectious form. Sulfonamide and pyrimethamine are two drugs widely used to treat toxoplasmosis in humans. Recommendation: CAPC recommends cats who test positive for antibodies to Toxoplasma gondii should be considered unlikely to shed infectious oocysts. Most infected cats will also remain asymptomatic. Eliminate cat feces on a daily basis. Toxoplasma gondii oocysts require 1 to 5 days after being passed in the feces to become infectious.